For search, everybody knows that it's generally through recruiters. They help quite a bit because they see through the difficulties that we go through by just picking up and phone calling a particular group. It might not be a good match. Now, the recruiters do that for us, so they become a good resource. And then we can go to general ads. Colleague referrals are really good because colleagues are people you have known during training or during your lifetime that you can really trust, and they'll help you out if they're in a particular job environment that they like, and they might pitch that to you, and you can go for an interview there as well. Then we have the program directors and faculty also doing referrals to you, and self-referrals from beautiful fairs like the one we have today. One important thing also is to make sure that once you boil down to the state, you consider licensure within that state before you continue your process in your interview, because those that have begun the process seem to be more serious with looking for that job. And if somebody else is at par with you after the interview process and that person has a license, there's a chance that you'll be relegated and that other person will get the job. So those are things to be mindful of. Coming back to the practice types, with neonatology, there has been an evolution and a paradigm shift where now there are classically 4 major types. We have the academic non-private, we have the academic private, and then the clinical is broken down to the small clinical base and the large private as well. And under the large, we have a subset, which are the mega large groups, which I'll talk about as well. Then we have the hospital employed. Location is very basic, it's just rural and then urban or suburban. This table just really identifies the different practices within the different types of jobs out there. Under the private group, which is the practice type, you have mainly clinical work, about 83% of what you do, and research is just about 1%. And in academia, it's pretty much the opposite. You do 41% clinical work and about 26% research. And hospital employee, they do a mixture of the two. With the rural setting, which comes very important in your decision making, after discussing this with your significant other and involving your family as well, there are certain things we have to be aware of. In the rural setting, they tend to reimburse more than they do in the bigger centers. But there are certain pros and cons we have to be thinking about. One of them is there's less subspecialist backup. So you have to be an independent practitioner. You should be very solid and not rely on too much subspecialists. So you have to also realize that out there you might be on your own. It might not be good mentorship. Occasionally, after coming out of fellowship, you need somebody to guide you through and help you along with decision making when it comes to social issues, and sometimes with clinical management as well. So that might be lacking in the rural setting unless it's a program that's already been set up. There's going to be more hands-on work because the nurses and staffing there are not used to the continuous exposure to sick babies. So you have to make sure you keep their clinical skills up by constantly teaching them, and that's going to be part of your job description. So those are the main things. But for the rural area, you have to make sure your family has reasons to go there, so you don't end up being surprised, okay? Make sure it's not because of the money. With the bigger urban centers, there are benefits and some disadvantages as well. With the benefits, you do have all your subspecialists, you have guaranteed nurse competencies are pretty strong. There's high acuity, which most fellows and neonatologists want. There's better mentorship because you have seniors who will hold your hands and help you out in tough times. And probably you might have residents and fellows that cushion your clinical work, but still you're going to be responsible for those patients. So your workload is still going to be significant. Apart from that, your ancillary support is going to be very solid as far as the other departments, radiology, respiratory care, and things like that. With the suburban, it's really a blend of these two. Coming back to the group dynamics, I'm going to concentrate on the large group, which is pretty similar to the group that I'm in right now. And my guideline here is more than 10 neos, covering more than 10 NICUs and within 1 or 2 states. Generally, the larger groups offer some benefits, and those include their often set guidelines and practice protocols that make things a little more straightforward. Their structured contracts and interview process. They tend to have regular objective physician reviews in place, and there's a clear-cut hierarchy in authority. So you know who the boss is, who to go to when there are certain issues, and those are pretty much well spelled out. Typically, they also have a robust productivity model where you can have bonuses structured on those bases. This you not see in the smaller groups. That being said, there's now a paradigm where there is bigger groups coming out. And these I call the mega groups, where there are more than 15 neos, more than neos and nurse practitioners, covering more than 50 NICUs and cross-state levels. And with these, you have the same pros and cons, except that you might feel that your voice is not clearly heard, which is a very important thing we hear from lots of people. And then also, there's not direct access to the corporate leadership. Many people don't even know who their bosses is. And that's one shortfall of that model. With a smaller group, there's a little difference. There you have maybe less than 6 neos covering about 5 to 10 NICUs and in less than 2 states. The advantages here is there's direct access to leadership, so if you have any issues, you go straight to the top. You're entering when they're in a growing phase, so your voice is really heard and you make a better impact in the growth of that organization. So many people want that sense of entitlement, and that'll be a good position for you. There's more cohesion in the group, and the schedule is a little more flexible because it's a smaller group as well. There's one shortcoming, which is really the fact that because there are fewer hospitals, your job security is not as secure as the bigger groups, because if you lose a few hospitals in the smaller group, there might be a shift and difficulty in placing the neonatologists that are already in the group. So that's something you have to keep at the back of your mind. And there's less of a structured bonus paying scheme available. Now, points to talk about during the interview process really depends on what you really want to do. So those that are going to be in the hospital, in the private sector, if you are going to be in a particular hospital, you have to really think about the location, as I mentioned above. And each state has differences in its level of care. You can have a level 2 hospital in one state where you can keep babies that are 28 weeks and above. In another state, you have to ship anything that you put on oxygen or you start CPAP. So you have to really ask questions when you go for your interview so there are no surprises. With the schedule, lots of questions. Whether it's in-house based or it's going to be from home, that is a very big issue because many people could have kids or a single family for that matter. And some people just want to have calls from home. So you have to put those questions on the line as well. The number of shifts have to be discussed up front, and always remembering that in a group, things could change. If the new hospitals that the group acquires or loses a few, the schedule must change a little bit. So you should be a little adaptive to that. And then apart from that, you also have to feel very comfortable with the group. During the interview process, make sure you meet as many people in the group as possible. You really want to have that feel that you gel together, and this is a group you want to be part of. In academia, things are a little different. It's more of research-based, so make sure your research interests are compatible with that particular facility. Make sure your research months are well-defined, your off months also well talked about, and your lecture interests are also compatible with that particular facility. With the hospital employed, it's really going to be about contractual agreements. And definitely a lawyer has to be involved, and there has to be a lot of discussion. If it's a salary guaranteed model, when does it end? And also, is it practical when you go onto a productivity model if you're going to get paid? So those should be discussed up front. Is there a backup plan for vacation? If you're the only neo in that town, that has to be discussed as well. And then the overall expectations. Sometimes if you're hired by the hospital and the census is low, they might ask you to go to the ER, help with some pediatric care, things like that, which could surprise you. So you need to ask these questions pretty early in the interview process. Talking about skills, circumcisions are becoming very popular now in the private group. So those getting to the close of fellowship, it's a good idea if you have the ability to get exposed to doing circumcision to acquire that skill, and that will be very helpful. Now the last thing I just want to mention is the breaker and maker list, and I think everybody should have that. Have at least 4 issues that you and your spouse and your family have discussed and you think are going to be paramount in your decision making. in that if you didn't have them, you will drop that job position, or you will work towards having them in your contract. And these could vary from location, teaching capabilities, benefits, vacation. There's some that home is far away from the United States, and they require maybe 3 weeks vacation to spend outside because it's expensive. But some groups will allow you only 2 weeks at a time, and that's a decision that you could add to your make or breaker list. So in summary, my main point here today is to have a plan when going out looking for a job. The paradigm has changed a little bit in neonatology, so you should have a plan when you're going out looking for a job. First, decide what you want to do. Are you in academia? Are you in clinical? And if you want to have a blend of both of them as well, those jobs do exist, but you should know what you want. Then go towards location. Figure out what state you want to be in, what kind of setting. Is it going to be urban, suburban? Discuss it with your family. And when you start the interview process, make sure you do a lot of research about the town you're looking at. And then you look at the dollar sign. Don't look at the dollar sign first. And I'll be happy to answer any questions. Thank you.